Guyana's two monkeypox patients, who the health authorities say have no recent travel history outside of Guyana, are currently being treated and isolated at a section of the Infectious Diseases Hospital at Liliendal, Georgetown. However, Minister of Health Dr. Frank Anthony, during the Wednesday's edition of his health update, noted that officials at the National Public Health Reference Laboratory are still conducting contact tracing for the two persons, while their family members and persons who they have had close contact with have all tested negative for the virus but remain in quarantine and are being monitored.
The immediate family and so they are in quarantine and we are observing them. And so far we haven't seen any signs of anybody developing monkeypox.
While contact tracing is ongoing, he noted that it is very difficult to track and trace where how the individuals have contracted the virus.
It is very difficult to track and trace.
Dr. Anthony highlighted that both patients will be discharged from the facility based on clinical and laboratory criteria after being in isolation for some 14 to 20 days.
So that depends on the patient's, how the patient has been healing. But generally, from the time of exposure to the time the patient has clinical manifestation. So let's say from the time of clinical manifestation, it will probably be about 14 days or so.
Additionally, the minister explained that after showing no signs of having the virus during the isolation period, the patients will not be infectious and will be discharged.
There are patients who can develop complications. So if there are those who develop complications, might have to stay in the hospital for a longer period.
Minister Anthony also urged persons to utilize the Ministry of Health's toll-free 0449 hotline to ask questions or have concerns related to the virus addressed. According to the World Health Organization (WHO), there are over 47,000 confirmed cases of monkeypox in over 100 countries. Reporting for DGP 19 News, Joel Vogt.